The pain that I have basically covers my neck to my feet. The pain from arthritis is deep down in the joint, in the bone. It's very, very hard to live with.
34 million adults suffer from chronic pain.
The pain right at the base of my skull feels like someone swung a baseball bat into it. Just a really sharp, hard pain. And it feels like a knife being driven in, except not just one place, but both sides of my spine.
50 million work days are lost each year due to chronic pain.
It felt like somebody had an ice pick all the time, gouging right down in my backbone, just wiggling all the time. And it seems like the pain goes right up to your brain. I mean, it just devastates your brain so bad. I mean, it's like somebody standing there gouging all the time. It's 24 hours a day, 7 days a week.
1 in 5 patients is dissatisfied with their pain treatments.
The pain would get so intense, it just felt like somebody was taking my muscles in my back and just twisting and just not until it got so tight. It's almost, you just wait for it to pop and spring.
Chronic pain can lead to physiologic damage, emotional distress, functional impairments, inability to participate in rehabilitation, and inability to work. In this program, these and other patients, all of whom have suffered through years of varying degrees of chronic pain, tell the story of their long, often frustrating, always painful search for adequate treatment. Dr. Alan Spanos is a pain specialist. He received his medical training at Oxford University in Great Britain and completed a fellowship in internal medicine at Duke University in North Carolina, and now runs private practices in both Raleigh and Chapel Hill, North Carolina. Dr. Spanos will describe the plight of these patients and explain why he thinks they encounter so many obstacles to adequate pain treatment. And finally, what patients and doctors can do to address this problem.
Sadly, we've known for years in medicine that we in medicine are doing a very poor job of treating pain. Study after study has shown that medical students are not taught about pain, doctors are not prepared for the treatment of pain in their residencies, and if you look at the population at large, many people, perhaps most people, with chronic severe pain are getting treatment which falls far short of what we know they could have given the state of medical science. There's a major misconception, I think, in the medical profession that pain treatment consists largely of pain management, and people seem to mean by that that you can only teach patients in pain to live with their pain. And so often I hear that back from the patients, that all the doctor could offer was help living with the pain. Well, that's not what pain treatment is. We don't treat diabetes or asthma by teaching people how to live with their diabetes and asthma. We treat the diabetes and asthma, that is, we shut it down as far as we can. We treat it, we reduce it, we make it better. That's what we can be doing, and that's what we should be doing with pain. We should be treating it, we should be making it better, not simply helping patients live with it.
I had my hip joint completely destroyed by the disease, and from there it seemed to really pick up the pace, and it was one joint after another that was being destroyed. I had to have one hip replacement, one knee done, and the other knee done, then the hip fixed again, and it really took over my whole life. So I started seeing a new doctor, and he changed my medications from aspirin to an NSAID, indomethacin, and low doses of prednisone. And he gave me some Percocet on the side too. I asked for some pain medication, and he would give me small prescriptions for that. And that went on for about a year or two, and I kept asking for more and more Percocet. He'd give me a prescription for about 50 tablets, and that was supposed to last a couple of months. and it would only last a couple weeks for me, and I'd go back and ask for more. And he finally threw his hands up and said, "Susan, you're an addict. I can't deal with you. We need to get you off of this medication." And I believed him.
You know, if you're in pain, a lot of them try to accuse you of being a drug addict or there to get a high, you know, and you just leave when somebody's in pain. That, you know, the feelings are a lot easier hurt than if they're not. And you know, and you leave with I leave with my feelings hurt and still in pain, and it's pure frightening to me to when I found out how little doctors knew. A lot of the doctors knew about pain.
I had sleep disorders from the pain. If you define a disorder as something causing me to have to wake up, other than a dream or a noise externally, it was the pain in my shoulder. If I would turn over and while sleeping, I would wake up, boom, and then I'd have to get up and go take some Tylenols or whatever they were, Loratabs, Vicodins, Percodins, whatever.
The only time I wasn't hurting was when I was asleep, and then being in pain, most time you couldn't sleep much. And I mean, I've been like 3 days, only get 3 or 5 or 6 hours sleep.
Usually 1 o'clock, 2 o'clock, any time between 1 o'clock and 5 o'clock in the morning, wake up, leg pain, leg numb, can't sleep, you know, just sleepless nights. So you take your medicine, you're already behind, so you take your medicine right then, and then you get up and you go. And by the time the day is over, you're already behind for your monthly schedule.
When you're treating patients in pain, the goals of therapy are very straightforward. It's two things. You want that person feeling substantially better and functioning substantially better, the two F's. Sure, we have tools, we have psychometric tests, we have questionnaires, but really when it comes down to it, the important thing is just to listen to what the patient's telling you. And that means listening to the language they use, where they hurt, how it feels, and most crucially, what it's doing to them, how it changes their lives. So I always ask about how they're managing with the things we all have to do every day. Getting out of bed, getting to the bathroom, using a toilet, vacuuming, who does the groceries, who does the yard work, all that basic stuff that we all have to do to get through the day. Once you've asked basic, simple, common sense questions like that, you've learned as much as you need to, and probably just as much as you would learn from pulling out a psychometric questionnaire for the patient. It's the doctor's sympathetic ear that is the main diagnostic tool and the main assessment tool.
Gradually, I started seeing a GP, and finally, after about a year, we had these problems, and I tried to talk to her about chronic pain, and she said, told me one time, she said, "Well, if you're a cancer patient, I'll be glad to write anything for you, but you're doing fine and you look fine. You're all right." She sent me to a pain clinic. I met the doctor. He saw me for about 30 minutes. He didn't look at the records that I had, and I told him what I'd been taking. He came back in and said, "Well, you're taking too much medicine for how you're feeling." I got in the car, and I realized, I said, this doctor just told me how I feel. And I went, wait a minute, this is not going to work.
For a while, they were giving me pain medication. Not very good pain medication because it never took the pain away. And it got to the point where they started treating me as if I was really just coming to them because I wanted pain medication. I was a drug addict, and that's how they started treating me. Being the mother of 4 children and the grandmother of 3 children, I was constantly looked upon to provide family functions at Thanksgiving and Christmas and, you know, the summer holidays, the 4th of July, and when they were always looking for some place to go for the cookouts, and you would try to do it because you wanted to be there because you're the person that your children come to look for. If I didn't have medication to see me through those times, and the holidays were the worst because I knew if I didn't, I was never going to be able to make it through those times, through those holidays with my kids.
One day I had a lot more pain than I had even had regularly, and I went to the specialist. I had them work me in because I was in so much pain. And every little jarring motion, I mean, if the car went over a manhole cover in the pavement, it was extremely painful, besides this high level of background pain. So I went in complaining about that, and he said, well, the next time you aggravate it, put ice on it. and sent me home. That night I woke up and I decided I'd sit up in my rocking chair instead of lying down. So I sat down in the rocking chair, and my husband went back to bed and turned off the light. And what he didn't know was as I sat down, I passed out and started going into shock. And fortunately, he heard that I was having trouble breathing all of a sudden. And so he called an ambulance. And the doctor's comment the next day was, well, I was just always taught not to give narcotic painkillers for chronic pain. When I passed out from the pain that night, I wasn't angry until I found out that it was completely unnecessary. Then I was very angry.
There's another serious misconception, and that's about the medicines that we use for pain. There's no question that our best, strongest pain medicines are the opioids, but these are the same drugs that have a reputation for causing addiction and other terrible things. Now, in fact, the rate of addiction amongst pain patients who are treated by doctors is much less than 1%. They don't wear out, they go on working, they do not have serious medical side effects, and so these drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain. There are 4 concepts that we doctors, almost without exception, were not taught in medical school, but they're crucial for treating pain. First, addiction. What is addiction? There are several definitions, but they all come down to the same thing. Addiction is an uncontrolled, compulsive use of a drug despite the fact that it's doing you harm. I'll say that again. An uncontrolled, compulsive use of a drug despite the fact that it's doing you harm. Now that's different from the second concept, physical dependence. Physical dependence sounds bad, but all it means is that if you stop using the drug, then you'll get a withdrawal syndrome. The withdrawal syndrome will make you feel ill, and that illness will be specific for each drug that induces a withdrawal syndrome. But it's clearly got nothing to do with addiction because it doesn't have a psychological component. So that's concept number 2. The third concept is tolerance. We were often taught that tolerance implied addiction, but it doesn't. Tolerance just means that you may need to increase the dose of the drug to get the same effect. But that doesn't go along with compulsive use of the drug, doesn't go along with any of the other things. The fourth concept that you have to manage pain is the concept of pseudo-addiction. Pseudo-addiction is a fairly new term. It only came in about 1990, but it's crucial. Pseudo-addiction is when a patient is looking like a drug addict because they're pursuing pain relief. So pseudo-addiction is relief-seeking behavior mistaken as drug addiction.
Somehow he decided that 6 tablets a day were the right amount for me, 6 Lortab a day. And he continued to prescribe that for less than a year. And again, I started asking for more and more. And he got frustrated again and said, I can't deal with this. So we turned over the management of my Lortab to my gynecologist, the doctor I was seeing at the time for treatment of endometriosis. And he came up with the idea of sending me to the drugstore every morning to pick up my 6 tablets. Because if I got more than that, I would take a few, I'd borrow a few from the next day or maybe later in the week, and then by the end of the week I'd have maybe 2 tablets a day to get by, and it was almost impossible to live like that. Finally, a couple of years ago, after I'd had yet another joint replacement surgery, I finally hit rock bottom. I was about to start back at work and about to start back on my daily visits to the drugstore. And I said, I just can't live with this anymore, and I was about ready to end my life at that point. I lost jobs along the way because of my illness. Of course, that took away our financial security. It's always been a struggle to pay all these medical bills. Even though I have health insurance, we still pay thousands of dollars out of pocket every year.
It took me a while to ever get into disability, and financially, when I shut down my construction company, after I had the surgery and couldn't carry on, the way we got by and made ends meet was I sold off a little bit of my equipment at the time, too. I'd sold all my equipment. And then we had no income. But then when I got to drawing disability, I only drawed, you know, just $1,200, $1,400, $1,300 a month. It wasn't much. And basically, we couldn't hardly get by, couldn't hardly pay the bill. They cut my phone off. I lost my phone. I lost my hospitalization insurance. I lost the life insurance policy I'd been paying for several years. I lost about everything we had there except I saved my home. And I had a car and truck, you know, we saved that. But after I got on the disability, we were able to manage and eat. But there was a lot of things in life that we didn't have. My kids, they couldn't no more have things at school, new shoes and all like the other kids were getting. And I really felt very depressed.
Doctors have a major concern when patients start taking opioids that these are drugs which are going to blur their minds, that they'll make them sleepy and vague and that they'll look stoned all the time. Nothing could be further from the truth. When patients are in pain, being in pain blurs your mind. As the pain recedes, the patient's mind typically gets clearer, they become much more competent and able to do what they need to do. And it's important to remember the side effects of opioids are in a way very safe. There are only 3 common ones: sedation, nausea, and constipation. The sedation and the nausea normally settle down to little or nothing within about 2 weeks. The constipation persists sometimes for months, but it's very easily treated. They're not the sort of significant major organ damage that we worry about with other medicines. These are not medicines that can damage your kidneys, damage your liver, and so on. If used right, they're very safe medicines. The most important things we can do for patients with chronic, severe pain is just to listen to them. That's what they tell me time and time again, that the most important thing their doctor can do for them is just to listen to them, take them seriously, and then try and help. And the other thing we have to do is simply to take opioids seriously, to think of them more often when we're treating patients with chronic pain, to work on dispelling our own misconceptions about what these drugs are and what they're not, and to work on dispelling those misconceptions in our patients' and their families' minds as well.
After I started taking the painkillers, I'll never forget the first time I woke up for the first time that night, and it was 5:30 in the morning. I mean, I had not slept that long in one block of time in 5 years. It was such a shock, but I was thrilled. I'm coming home from work still with energy to spare. I'm comfortable when I get home. I'm ready to, say hello to my husband and sit with him in the evening, and just to have an evening that I can still do things with is unheard of. This sounds like a little thing, but just being able to go to the store by myself and pick things out myself instead of being dependent on other people to pick it up. That's a chance for me to choose things for myself. That seems like such a small thing, but it's the fact that I can make my own choices. Also, in the beginning, I couldn't drive at all. That's something I'm now ready to go back and try again. And so now that I can do more things, I have more options. Another thing, especially about the Oxycontin, is that I feel like a real participant again, instead of that I would just go and sit on the sidelines. And I'm more of a partner to my husband again, which is really important.
Knowing now that I've got someone that understands and that we have found something that works, it's a lot more confidence building to say, yes, I can go somewhere and I don't have to worry about, I'm sitting out here and something happens to the car or somewhere and all of a sudden things start wearing off and I don't have any medicine. That's the scariest thing that can happen. It's happened to me more than once. Just freeze up. Well, it takes a lot of anxiety away, that you can just take the medicine and go.
This pill, that's the time release pill, solves all the problems. It enables me to get out to do the exercise, and as we went along, I did more and more to the point where I do it every day, and then all the blood levels came down, the cholesterol, the triglycerides, whatever. And my blood pressure now is like 120 over 75, my pulse is 61, and I was like 160 over 120. The guy said I was going to die. The physical therapy hopefully will get me strong enough where eventually I won't need to use the drug therapy, but the drug therapy allowed me to do the physical therapy, which in turn lowered my blood pressure and lowered the blood levels.
Obviously, good pain treatment has to be multifaceted. It's not just medications, it's also physical therapy, often occupational therapy, often psychological interventions, including things like biofeedback. But the fact remains that the main area that we can improve on, and the approach that's available to every doctor with a prescription pad, is just for us to do a better job of prescribing strong pain medications, and I mean opioids.
Since I've been on this new pain medication, I have not missed one day of work, and my boss really appreciates that. Lauren is there every day, so I'm able to be very productive, person again, which is really great. Also, since I've been on this new medication, this pain medication, I no longer have problems sleeping through the night. I take my medication. It's pretty much the last thing I do before I go to bed, lay down at night, and I'm able to get a complete full night's rest. I'm not waking up in the middle of the night any longer. I'm waking up very restful, ready to start another day. And one of the things that's really dear to my heart, and which I'm especially excited about, is just the fact that I'm able to spend time with my grandchildren. They are 5, 6, and 7. They love their grandmother. They love to play with their grandmother. They love to spend time with their grandmother. And in the past, I was not able to spend very much time with them, play with them the way they wanted to. Now I do things like going to the park. I can swing on the swing with them. We can slide the slide. And it's amazing just to be able to keep up with them and not have to always constantly tell them, Grandma can't play now, Grandma can't do this, Grandma's hurting, Grandma's back hurts.
Yes, you have lipstick on too.
I got my life back now. Now I can enjoy every day that I live. I can really enjoy myself. And before, even a good day was hell. I mean, I couldn't enjoy nothing. But now I can enjoy myself. That's when I say it's wonderful. I look at the future the same way a young guy, 25, 30-year-old would. I mean, I got the whole world in front of me now. Now I see I can go back to work. If I can work, I can make money. I can provide for my family. You know, I can get my kid a car when he gets 16. The future just looks great. I mean, I see that my company can grow because now I know physically with my medication, I'm able to get out there and work and make my company grow. And if you can get the right medication, the right doctor that'll treat you and look after you, there's all hope in the world. I mean, you know, you can get right back to normal. I mean, you know, it's great. I just can't explain how happy I am today. I mean, it's just wonderful.
When I started taking Oxycontin 2 months ago, it was the first time I had felt normal since my original injury 10 years ago. All that time I had suffered greater or lesser extent of pain, and now I feel absolutely normal. It's wonderful to be able to get out in my kayak again now and not have to pay the price afterwards, physical pain. I was amazed, I was astonished. I didn't think it could happen. It's fantastic. It's just been a huge change in my life.
I'm currently at 1,200 milligrams of long-acting Oxycodone. The brand name is Oxycontin. Most people, when they hear that, think, oh my God, you must just lay around in bed all day, you're really zoned out, you can't do anything, you can't function. But it's not like that at all. Instead, I've become a more active and productive person. I handle the finances in our house, I organize all of our trips, I do all the shopping, I do swimming every day. I even do our taxes, and you got to have a fairly clear head to do that. So, now this medication does not turn you into a zombie. It has turned me into an active person again. And all these pictures, I look at myself, I look so heavy and so unhappy. And now I look completely different. I feel different. Life is wonderful again. I have found life again, and it's worth living now, and I'm so grateful.